Right, good afternoon, everybody. My name is Emily Huff and I'm Editor-in-Chief of the Crisis Response Journal. We're working with the Emergency Show and the International Disaster Management Exhibition, which are part of the World Humanitarian Forum's portfolio. And the aim of these platforms is to bring decision makers and opinion formers in the public, private and non-profit sectors together. And to this end, their annual exhibitions and conferences are designed to enable global discussions and transform conversations into action. We've been working together on a series of webinars and other ventures, all of which aim to encourage a cross-sector and multidisciplinary dialogue, along with partnerships and inclusive networks, with the ultimate aim of enabling the international community to connect and shape the future for a better tomorrow. Today's topic is of vital importance to each and every one of us. We're going to be discussing the mental health effects of the COVID-19 pandemic on society and on first responders in particular. And this isn't going to be another hand-wringing webinar. We want to examine the subject unflinchingly. We're going to be looking at aspects of post-traumatic stress disorder, the effects of prolonged and acute stress, and some of the impacts in terms of society, whether these manifest through increased substance abuse, domestic violence, suicides, or generally even the question, what happens when individuals or society as a whole lose hope? What about overlooked or hard to reach individuals or communities? Are there generational divides? We all know there's signs that we can look out for in ourselves and in others, but how many of us take heed until it's too late? And of course, there are techniques that we can use to help manage acute stress, prolonged pressure, and the consequent mental health issues. Equally, though, it's vital to recognize that no one size fits all. So I'm really happy today that we've got three incredible people who've lived and breathed these types of stresses themselves and want to discuss ways forward based on both lived experience as well as their work and research. They all bring varied perspectives and experiences, so this is going to be a wide-ranging discussion. And I'd like this to be a webinar of hope, not of despondency. The format is as usual, it's 60 minutes, and each panelist will introduce themselves, and then we'll go straight into the questions and discussion. And for the audience, feel free to comment through the chat function. And I'm going to do my best to ensure that all extra questions are answered, albeit I have to make the usual proviso that we could well run out of time. So enough of me taking up that precious time. I'm going to introduce each panelist and then they can make their own introductions and give you their initial thoughts. And the introductions this time are really easy if you read the Crisis Response Journal and have accessed our very latest edition, because you'll have seen articles written by all three of them. Amanda Coleman has more than 20 years of experience in leading emergency services communication teams, and she was head of communications at Greater Manchester Police in the UK, dealing with the Manchester Arena attacks in 2017. She now runs her own agency, and her first book on crisis communication strategies was published earlier this year. Marcus Coleman leads at the intersection of community engagement, crisis management, and capacity building as a means to strengthen community resilience. He currently works at HWC as a senior associate, where he helps to build multi-sector partnerships that help people before, during, and after a disaster. I'm not sure any introduction I give will do full justice to the immense scope of his expertise and what he actually does, so I'm glad he'll be introducing himself as well. And the same goes for Lisi Kota, who is founder and CEO of Lions Group Global and Global Mental Wealth. I can't completely summarize everything she does in such a short time, but one of her particular areas of expertise lies in advising defense, aerospace, mental health, and crisis and emergency management organizations. So without further ado, I'd like to kick off, and I'd like to invite you, Amanda, to start, please.
Yeah, I mean, this is such an important area of crisis communication, of emergency management, and I think it's only been in the last few years that we've actually started to be able to look at it in a really useful way. I think there's a lot to do, we're much better at talking about it now, but there's a lot of action that's, I think, needed to come from that. And I talk about this mainly from experience, because I felt I was indestructible for many years and suddenly realized about 3 years ago I wasn't, and didn't listen to the signs, as you were saying at the start, didn't listen to what was going on with me, myself, and 3 years on, it's taken that length of time to really get to a point where I've been able to deal with things. So it was one of the reasons why in the crisis communication book, as you mentioned, I actually devote a whole chapter to well-being, because for me, it's a fundamental part now of the crisis response, but it's also a fundamental part of the crisis communication element of the response as well. So that I'll just start that briefly.
Thank you so much. And that's true. I mean, there has been a lot of talking, and hopefully we can start looking at some of the actions that are needed now. And I also completely accept the point that, well-being is fundamental for, otherwise, why are we doing what we're doing if we're not ensuring that people are well in themselves and we're looking out for signs of mental health problems and so forth. Marcus, if you could now introduce yourself, please.
Absolutely. Thank you very much, Emily, and appreciate Crisis Response Journal and all of the organizations that have come together to pull this important discussion together. So I'd say a consistent thread for my experience is actually working alongside faith-based and community-based organizations to help people and first responders before, during, and after disasters. I think similar to Amanda's point, in my experience early on in emergency management, felt a bit indestructible, felt like my job was to help people, so I had to find a bit more energy, but have learned over the years the importance of self-compassion, self-care, and making sure that you build an infrastructure that helps care for the caregiver. So incredibly excited to be a part of the discussion today. Be sure to, as I'm sharing I'll be sharing resources with folks in the chat as well for some of the topics. And so a lot of the perspective that I'd bring, again, is going to be from that experience of working with faith-based and community-based organizations who are committed to mental health, emotional, and spiritual care.
That's fantastic. Thank you so much. And yes, we're not indestructible. I think that's what we all have to admit, isn't it? Right, Lisi, if we can come to you, please.
Thank you, Emily, and thank you, everyone. Crisis Response Journal and World Humanitarian Forum. Yes, my mission so far is to work with mental health since I started to work with people in defense industry and military. And I realized the problem that it is when it comes to all this stigma around mental health. And that's my concern, because the rates of suicide are too high. I work primarily with the United States, and there are 22 suicides per day in the military. So that's alarming, and we have to do something. I want to be part of the change, of the ones who are doing something, taking actions to tackle this problem. I know that it's not going to be easy for our organizations to finish this, and especially with COVID. And I have done my mission to understand first what is the problem, what are the root causes, and then try to find solutions, not only for the military, but also for crisis managers, emergency managers, all first responders, the ones who are on front lines. Thank you.
Thank you so much. And that's a very sobering statistic. And I suppose it will be many years before we really truly understand the effects of the pandemic globally and more locally on mental health. But I think all the warning signs are very, very clear already. And I think everyone watching this, and including ourselves taking part, we are aware of it. We do know when the warning signs are there. So if I can sort of dive right in now to the questions and so forth, if I could ask you each, what do you consider to be the current situation with regard to mental health generally, and also widen that out to globally? Who do you see as being most under pressure, and what areas do we need to watch out for in particular? Marcus, if we could start with you, please, on this. You're on mute.
Sorry about that. Absolutely. So for me, I'd say one of the things that we knew as the pandemic was beginning to impact in the United States and globally, that there was going to be outsized impact on people of color in the United States, African Americans and Latinx communities, but in particular, and that's definitely played out. And so there's some recent research that just talks about some of the compounding stressors even before the pandemic that were impacting people. So you had, you had economic losses, job loss as it relates to the pandemic, continued stresses as it relates to childcare issues. Many of the people of the color in the United States are actually going to be some of the frontline workers. So when you look at the folks that are nurses, doctors, some of the folks that are working on the front lines, many of them are colored people as well. And so the situation continues to be dire and continues to be stretched thin. And then when you think about the burden that's being placed on the practitioners themselves, so the mental health professionals, thankfully there's things like Talkspace and telehealth, and that kind of spreads out some of the opportunity for people to access mental health services, but there's still a limited number of psychologists, psychiatrists, mental health professionals. And so there's an overall strain, I think, on the system, and we're just in month 9. And so one of the things that we're very much thinking about is burnout and compassion fatigue, especially for those people that are going to be looked to lead through the long phases of different forms of recovery, from the faith leaders that may be meeting different needs now to some of the community-based leaders. So there's definitely a strain there. And yeah, it's not just the direct trauma, but the vicarious trauma. So if it's not you losing a family member directly, maybe you lost a family friend or dealing with other types of mortality issues that maybe aren't specifically COVID related, but definitely happened in the pandemic context, is causing, I think, additional stress and strain for folks dealing with unreconcilable loss.
I think that's also, to add to the vicarious trauma, is also just generally fear, because it's that permanent worry about trying to protect your family, trying to protect your friends and loved ones and so forth. And I don't know how much you can balance that with the need to protect yourself and the fear of being, it's all the warnings. And that's something that we can move on to communication, hopefully, as well in Absolutely. A second, Amanda. In fact, can we go to you next, Amanda, and get your perspectives on this, please?
Yeah, I think it's such a difficult thing because everybody's been affected in some way. So it's the scale is huge, and everybody's got their own personal story about how they're affected. Just as Marcus was saying, and those at the very centre are the ones obviously that are the most affected, that would really need the most kind of support and help. But unfortunately, we all have got things that we're carrying linked to it. I speak to a lot of communicators who are at the point of collapse a lot of the time. Emotionally, they've done so much, they've been kept going, and suddenly we're 9 months on, and they've not taken holidays, they've not taken time off, they've not stepped away from it. And you just can't keep functioning like that. At some point it'll all kind of close in. I think the difficulty is, firstly, obviously, like Marcus was saying, is having to be able to access to help. Admitting that you need some extra support, admitting that you need to use services where you can talk things through is problematic. And some people, going back to what's been said earlier, some people still don't want to admit because they feel it's a sort of sense of weakness if you aren't coping. Right back at the start of all this, everybody was going, "Oh, how are you managing? No, how are you managing?" And we really meant it. Now I think it's become a sort of trite phrase that doesn't actually mean anything anymore. So for me, I think this is definitely, it's got to be a long-term program of consistent availability of support, of recognizing people need to understand how they can be more resilient themselves. That it is okay to have a work-life balance. It is okay to not be permanently attached to devices and working all the hours of the day. And I was going to say this just so much, but how's everybody coping with it? This is an unprecedented, and I hate that word, but it is, scale of crisis. And from my kind of past experience, if we had a member of the team who had been personally affected by a crisis, by something we were dealing with, then you could take them out of it. You could say, look, you go and, deal with what you need to deal with. We'll deal with the crisis. Then, when you're ready, you could come back. We've not been able to do that. So everybody's been dealing with it and having to carry on and work. And so I think having that space is the most critical thing.
It's really interesting, isn't it, that you mention the stigma and so forth. And I often wonder if there's sometimes unintended consequences or a disincentive in some roles to actually admit that you have a problem, because you could actually be taken off your job. You could lose things that you actually like doing. And that's really difficult. How do you balance a short-term crisis over the long-term things that you do? Lisi, if we can turn to you, please.
Sure, Emily, thank you. Well, we all already knew that there were a lot of mental health disorders, problems prior to COVID, and COVID just enhanced them, because people who already suffer from substance abuse, neurological problems, and mental health disorders just fell into this trap when we started with lockdown and isolation. So if we go to statistics, as you said earlier, according to the International Suicide Prevention Association, there are 800,000 deaths per year by suicide. And that represents 55% of all deaths in the world. There are more people who die due to suicide, committing suicide, than in war or any other type of death. And if we talk about the youth, that is the second cause of death, suicide, and that is alarming, because from the age from 15 to 29, that is the method they use. So especially guns, or being poisoned, or hanging themselves. So in this case, when we do not have enough information, because no one wants to talk about it, we just have reports that 20% of children and adolescents have a mental health disorder. But how do we know if that's correct? Because also for the population in general, it is said that it's 10%. To me, those are not real numbers. It's too low. And also 79% of deaths by suicide come from low and middle income countries. So it's a combination of factors that all of them end into this problem that we just don't want to talk about it because of the stigma. We are trying to hide and suffer in silence because we are afraid to being judged, criticized, discriminated, even fired, or losing our relationships. So as long as we just don't end, or at least minimize the problem and the stigma that is all around talking about having a mental health disorder, or even anxiety, that is feeling depressed or feeling sad. That's how we start with all these problems. And that ultimately leads to suicide. And if we just don't return to, I am not going to talk about any religion in particular, but we all have to have faith in something, higher power, or even ourselves. But we just need to return to that, to have faith in something, because we don't have anything to hold on right now. We have lost our individuality. So that's back to you, Emily.
That's very interesting. And I think faith and, in whatever gets us through is going to be really, really important. And I think we'll come back to that, definitely. I want to ask about what do you think, what needs to be done? I mean, is this something that is community based? Is it something, I mean, there's sort of levels, aren't there? There's the individual's immediate circles, there's community, but are governments taking it seriously enough, or are they doing enough? And what needs to be done at a national and community levels? I'll start with you on that one, Amanda, if you've got any points on there.
That was because I was pulling a face when you said no. I think there's nowhere near enough support available at that sort of level, and there is a challenge in terms of have we got enough people with the skills. But I think, if you look at the moment in the UK, there's a website. Well, that's fine for some people who just want to get some information. But actually, what we need to be able to do is access the therapies, talking therapy, whatever it is. What I get concerned about is we rely on charities a lot for this, and they're going through a difficult time like everybody. So they've got their own challenges to deal with. I know from my perspective, when I went through some counselling, it was actually charity based. And I want to do everything I could to be able to give them some support for being able to offer that, but that shouldn't be where we access all this sort of help. I think there is a lot of support in the sort of faith, charity, community based, which is great, and I think I applaud everybody that does that work. However, it has to have more than that, and my concern is you have to be at the point of extreme distress and suicidal thoughts, etc., before you're going to get that level of intervention. We've got to do more in the early stages. We've got to do more with young people now, knowing that they're going through a terrible time, and they're going to have to deal with how that's affected them. And you can start to see all those, like you were saying at the start, those groups and people that are perhaps going to need longer term support. So yeah, it needs to start in schools. It needs to start with education as well, and teaching people to be ways they can be more resilient. So I think there's a lot of work to do, a huge amount of work to do.
That's very interesting, especially as you raise the issue of young people. And I think anecdotally, and from what I've observed as well, there's so many groups that are just retreating into themselves, and they're not going out at all. They're not engaging with people, and that's unhealthy in the short term. But in the long term, bringing yourself out of that is going to be really, really difficult. This isn't going to be the order that we're sticking with every time, but I am going to move on to Marcus next, please, and then we'll come to Lisi.
I appreciate that. So I think about it in terms of three types of investments. And I think Amanda's point is spot on. There has to be systemic investments from government in mental health systems. I'll say another pandemic that kind of reached a scope and scale where there was actually a decent program in the United States was for HIV and AIDS survivors. There was a program called the Ryan White HIV and AIDS program that was structured specifically to help people who were experiencing AIDS and HIV get access to mental health services. What's true for many of our caregivers, first responders, we're going to have a sizable number of people who are COVID survivors themselves. And so making some of those investments in programs like that would be helpful. In addition to finding ways to bring together mental health professionals and public health professionals, and making sure that the funding that's provided nationally or internationally is actually invested in local community infrastructure is going to be critically important. One of the other areas that I want to point to when we talk about the community level investments, I think one of the things that is happening is that you see organizations such as All Healers Mental Health Alliance, which serves a collection of professionals, sociologists, psychologists, coming together to make sure that they're making some substantial investments from the community perspective, but working alongside other faith communities as well. I very much agree with Amanda's point that charity is important, but it's not enough to really meet the scope and scale. And so we see some other efforts coming from universities. So for example, there's a disaster psychologist, Dr. Jamie Ayton, who's actually pulled together a mental health handbook that looks at the different types of resources and practices that practitioners can take, be they of faith or of no faith, in terms of really addressing some of the mental health issues. And I think that's going to be particularly important as we find ways to invest in, again, those doctors, nurses, firefighters, law enforcement officers, and those community leaders on the ground who are meeting the needs of others, but then also need to be cared for as well.
It's that age-old dilemma of it's much easier to get investment into something once any sort of crisis has occurred rather than in prevention. Lisa, your thoughts, please.
Thank you. Yes, well, we have to acknowledge that this is a global problem, and each nation has to address this to heal their people. In regards to who are suffering the most right now are the frontline workers, because they get to see every day the suffering of others. And if each country can provide more programs, government can create more apps. There are already some amazing apps that government provides, for example, in the United States for the military. And but we have to think that the problems that the military has are not the same problems that crisis managers, emergency responders, humanitarians have, because they deal with different things on their fields. So I think that creating specific councils and support groups for these specific fields would be very, very helpful, and offer crisis lines locally, at county level, and but with 24/7 access. And also, for example, in San Diego, there is this Suicide Prevention Council, and it would be perfect that could be instituted in each county, and for example, children and youth mental health centers too. So if we raise more awareness also using media and not just social media, because media has a tremendous influence in collective behavior, and you know it. So I think that will help us a lot, that support, because what media says is everything. So yes, we have to work together.
I think it's such a massive and multifaceted problem with so many groups. We seem to have lost Marcus. I don't know if anyone. Oh yes, hello, you're back. I'm so glad. If we home in slightly now on actual first responders and frontline workers and so forth, and I'd include track and trace callers, emergency managers, civil servants and key workers. Have you got any opinions on what the major effect of COVID-19 in terms of mental health and well-being has been upon this particular group? I'm going to start with Amanda on this, if you're happy to take it.
Yeah, I think for me, one of the things I think that people get is that sort of survivor guilt almost, when you're seeing things, as has been said. You want to do more. You always think, I could have done more. I should have been able to do something else. I should have been able to make that difference. I should have been able to stop that from happening. So there's a lot of emotional baggage that you just keep adding to. And because people have been working particularly, long shifts, will have been covering staff absences, there's no opportunity to release some of that. And what you're finding is, obviously, you just keep adding to it, and at some point you'll tipple over because it's so heavy, the baggage that you carry. So for me, I think it's a lot of this comes down to really simple things, such as, can we make sure that people get some time away? Can we try and do something about the staffing levels and the rotas that are in place? And I know that it's a challenge, and I know that when there are gaps, these things become problematic. But I see such bad practices where there's just no recognition that, if somebody's done a 12, 13, 14-hour day, they need to have downtime after. They need to be able to process things. They need to be able to, so there are some very simple things to try and deal with this. So yeah, it's a difficult one. I think the thing for me, definitely, as in being in a frontline role, it doesn't matter whether you're in at the front end in terms of seeing things, or whether you're, you know, in a communications role and you're hearing about things. You still take on a lot of emotional baggage about what you're seeing, dealing with, and kind of living through. And I think you find that's why you see a lot of anger as well comes out, you know, particularly from frontline medical professionals and people dealing in that world, when there's lots of, you know, well, this isn't really happening and I haven't experienced it, or whatever. You know, it transforms into anger as well. So there's a lot of emotions that are building up.
That's very true, and the heightened emotions. And I think one of the things that I've particularly picked up from what you've just said is regards, you know, making sure with staffing levels and so forth. And I think the pandemic, and I don't know there's a solution for this, but the pandemic has revealed so many vulnerabilities in lean organizations. It's also done it in supply chains and so forth. If you're operating on the barest minimum, whether in terms of human resources or other aspects of the organization, you just can't, when something happens, there's absolutely no scope for expanding that, is there? Lisi, can I ask you for your thoughts, please?
Thank you, Justin. Yes, I think that one of the solutions is to rotate people, to give some of them time off, because we tend to think that we have to take advantage of the most experienced, the ones who have more years working and the most resilient, and we bring them to the point of burning out. So right now we have to take advantage of people who would want to volunteer, who can work from home also, even if they are interns, because we have to reschedule this in a massive way, so we just don't keep overwhelming our best resources, because they are feeling overwhelmed. They have fear of working in an unsafe environment. And remember that they also have families. They have their own problems. And if we just don't slow the pace they have and reschedule activities and look for help, then they are going to reach the point of a serious chronic mental illness. And that will be the end of them, because we have to have faith that some other people can learn too. How are they going to learn if we don't give them the chance? Okay.
That makes a lot of sense, and it does. And it also, this whole question and discussion leads on to an audience question, which I'm going to sort of tag on to the end of you, Marcus.
Okay.
Because one of the members of the audience has asked, who's been, those who've been on the front lines of dealing with this particular scenario are in particular danger of burning out. And you've both alluded to the burnout and the being overwhelmed. And if we can sort of look also at what their organizations could be doing to help them more. And I think that sort of ties in very well with the major effects. So Marcus, if you could let me know what you think.
Absolutely. So I think in terms of some of the major effects, I think Amanda and Lisi covered those well. I think in terms of what organizations can do, so it's going to be similar to what governments can do. It's finding opportunities to build in some structural investment and helping to change up routines even for certain folks. And so we do know, right, that there's been a lot of people that unfortunately they've been doing 12-hour shifts for about 8 months now. And it's not going to stop usually. And I know Amanda would know this from her experience. Lisa would know this from her experience. You may have maybe a 2 or 3 month pinch that looks like that. And then you get a little bit of a reprieve and then you have to get back up again. But I think what a lot of organizations are going to be facing now is making some investments that allow for continuity. I think asking for grace from citizens and from governments. Unfortunately, we're going to have a lot of state and local budgets that are going to be cut short next year because there's going to be a lack of a tax base. But what we can't forget, and I think what organizations can't miss, is opportunities not just to pay for mental health professionals and providing services, either through chaplains or other services like that, but then also continue to make investments to make sure that we're continuing to retain talent where we can. And for folks that we know that are going to burn out and that we know we're going to be just creating and investing in clear off-ramps for people. Because unfortunately, what's true is there's probably somebody now who knows 3 to 6 months from now, they're not going to be of any use to folks in their current capacity. And they're going to need those 2 to 3 months. And so it's better to just own that now and make some of the investments to make sure that there's clear offboarding for staff or for leaders or for people that have served in those roles. But then when they're ready to ramp back up, make sure that we ramp them up in such a way that, again, allows them to continue to build back some confidence, because I've been on the other side of burnout, and it's not a lot of fun at the beginning. So I think being able to help give people some of those tools of how to piece their life back together on the other side of that kind of experience is going to be critically important. And I think the better organizations can invest in that now, the better off we'll be to face some of the challenges and crises to come.
I think that's true. I mean, if you truly value your people and you need your people, it's absolutely counterintuitive to suck them dry to the point where they can't function anymore. And that's really important. We have another audience question. It sort of carries on, again, a nice theme. Can we think about, is there something we could put in place to monitor employees so we can see the trends and patterns and then react before things get too bad? And this questioner says, we know the trauma or cause, as it were, which obviously in this instance is COVID-19 and the wider effects. So we can anticipate and expect the reaction. However, all too often the reaction is often just left to happen, and the whole, everything's left to unfurl, and then we pick up the pieces. Is there a more efficient and supportive way of doing this? Lisi, can I?
Yes, thank you. And yes, there is. There are some simple techniques, like just taking 5 minutes to talk to our employees and find out how are they doing. We just don't realize the power that has, just to ask, how are you? Are you feeling well? Are you having any problem? Is there something that I can help you with? That can make the difference. And I have been there between helping someone to want to talk about it or commit suicide. And it's alarming, and it happens. So besides that, talking and approaching and showing interest, we can also there are some applications that can be used. Technology, it has some advantages in that. So we can predict when someone is going through that path of being aggressive or committing suicide. So yes, there is something that we can do. And but we just cannot rely on apps or technology and just leaving everyone and not asking them to talk to a professional, because that is not the point. The app is just a tool that can help us to detect certain patterns, certain changes in behavior, but it's not the solution. Okay, the solution is first to address, to talk, to approach, to tell them, I see you, okay? You're valuable, you matter, because that's so important. And we need to make people feel that they have value, okay? They're not just a number working for us, and that we see them as individuals.
That's really interesting. Sometimes the value of venting is completely overlooked, isn't it? Marcus, what are your thoughts on this?
So one example I wanted to share actually is from out of Fairfax County, Virginia. They have a program. There's a few programs. So there's a program called Mental Health First Aid. And I think one of the things that we can see here in the United States, I think we should look for internationally as well, is those different type of programs that essentially help citizens be better neighbors to one another. And so I think mental health first aid programs and things like that are ways to make some valuable investments. I think one of the things that we often see too, I think to Lizzie's point, there's definitely touch points that as brothers, sisters, cousins, mothers, family members, loved ones, that we can be taking to have valuable check-ins with people. And the reality of it is, I think at the workplace, the first question most people ask is, how are you doing? And sometimes that's not authentic and genuine, right? How you're doing is just a reaction. But I think taking some time out to really create opportunities to build relationship and to build some common bonds through just, again, slowing down the pace a little bit in conversation, finding opportunities to connect in different ways, pivoting the conversation in different directions can provide space for people. I know one of the things, as much as we are using video teleconferencing and stuff, I've actually found the best way to connect with my friends these days and allow them a chance to open up is to give them a simple phone call, not force them to be on the video camera. So I think continuing to find those things matter. And then it's also important, I think, to make sure that if you are partnered or you find yourself in some form of partnership, either domestic partnership or otherwise, continuing to build relationship, not just with your partner, but with your family circle around you. We know that not everybody can do that in person, but those are some tactical things that I think would be super helpful.
Thank you. Amanda.
Yeah, my big problem, I suppose, in looking at this is that organisations needed to have been investing in well-being and looking at this before any of this happened. Because I know from personal experience, if somebody had then said, you know, we think this is a situation, blah, 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 and they started trying to be asking how I was or, you know, anything else, I would have automatically had the defences up. So I think when you look at a lot of organisations, they're actually starting from a very difficult position, and that culturally, it's not been anything that's been considered. So if you start to then say to people, oh, you're struggling, do you need some help? They're automatically on the defensive and thinking that there's a big problem. So I think you have to recognise the culture of the organisation as to how fast you move and what exactly you do. I'm also concerned about I'm lucky in that I've got a very supportive family, but actually I've never shared the details of a lot of the stuff that I've had to deal with because they're too closely connected with me that certainly I felt like I was burdening them. So in some respects, having people you don't know that you can access can be more beneficial than being tied to people that you know. Support networks are really important, like Marcus was saying, really important. But then I think for a lot of people, they wouldn't necessarily share. Certainly from a law enforcement perspective, because of the culture of the organisation, I think there's a lot of work to do to make it genuinely, an industry almost that recognizes well-being is an important thing, and it's only just started. I think probably certainly in the UK in the last 2 years. So there's a long road to go, and I think you've got to tread a bit carefully around some of this because it's so sensitive. If you do blunder in one way, it can push somebody completely in the other kind of direction. So culture, I suppose, is for me, culture of the organisation is probably a key one to start from.
It's a really difficult matter, isn't it? And it's how well you get on with people. And it's back to what I said about disincentives. There could be, you're scared to say something because it's why are they asking? Are they after my job? Are they after, am I going to be penalized in some way for this? And this is something really important as well. And I'm going to move straight on to Lisi with this one, actually, because I know that this is something that's very, it's important to all three of you, but what is the role of personal resilience in addressing the issue of mental health amidst adverse situations such as COVID? And how can you build that personal resilience? Is there any advice and any experience that you can describe?
Of course, yes. Thank you, Emily. Well, we know that resilience is the opposite to being fragile, to being weak, right? And to have the ability to bounce back from adversity. But we are so used to think that life doesn't change. And because of that, we suffer, because life is about changing. Life is about adapting. And we have to evolve. And in that path, we are going to struggle and we are going to grow. But how can we just grow if we just have the same situation all the time? So, because we forget that we have to go through experiences, we just tend to suffer and we just aim to have everything perfect. And that's why we don't develop that strength, because sometimes someone else is doing things for us. And we just expect that everything is going to be easy. And when it is not, then comes depression, suicide behaviors, because no one else has been telling us that, okay, we need to prepare. Yes, maybe you are going to face some challenges, and we don't have enough education about being strong, mentally strong, about being resilient. It's always something like living in a bubble and everything is nice and everything is going to be fine, but those are empty words. And once again, I think that the media could help us so much in changing that vision that we have about life, because we see that everything is so nice in TV commercials, and everything is happiness, and even drinking a soda is going to make the world to be wonderful, right? Everything is a party. So it's not like that. So if we just remember that we have to evolve, and like the natural selection theory from Charles Darwin, who survives? The strongest, and the ones who can adapt. So that's resilience. We all have had struggles. We just don't sit here, and I think that many of us, or all of us, have been through difficulties in our lives, but we have to recover, because there are two people in the world, the weak ones and the strong ones. And which side do you want to be? You have to believe in yourself. And once again, you have to believe in a higher power, or in your ability, your skills, have reinforced your self-esteem. And if we just overlook that, then we are going to suffer.
I think that life is never going to be perfect. And this comes right back to the way you bring up your children as well. You can't teach them that life's going to be perfect. You're going to teach them that they're going to have knocks, and it's about being there to support them when they have their knocks. But not everyone gets that. Not everyone has that that sort of upbringing or that sort of understanding. Marcus, what do you think about this?
So when I think about personal resilience and just kind of the importance of it, so I actually take a lot of lessons from people that I know that are cancer survivors. And people that have been through very, very deep and personal traumas that essentially lead to folks feeling lonely. I think one of the interesting things about this particular pandemic is it's also exacerbated or revealed just the significant amount of loneliness that people feel, and the ability, how difficult it is to make meaning at a time where you feel like, you have to find reasons to continue on in a lot of ways. I think for me, one of the things that I continue to look to and look toward is finding some practical ways to make meaning. And so it's not always, to Lizzie's point, it's not always going to look like a lot of the television commercials in terms of what we're doing. And when you're in the crisis leadership business, it's not always going to be the type of outcomes that you're looking for. I think that survivor's guilt or some of those disappointments and not being able to meet the needs and meet the moment in a way that that you needed to is another area where it's important to just take a step back and reflect and provide yourself some opportunity to have humility, one, and understanding that you can't control all outcomes, but then also taking practices of self-compassion and really being invested in providing time for yourself to reflect, to read, to digest, and to share. And I take Amanda's points very, very, very personally as well, is that, in some professions, in some disciplines, you have people that can't talk to their family because that's what their job tells them, right? There's only so much that they can share. And so trying to find personal resilience for those individuals who are responsible for keeping secrets or for doing some other things, and just in terms of protecting others, I think it's very important for them as well to make sure that they are constantly trying to build a structure and a culture that works for them, that allows them to express different forms of self-compassion in a way that helps to maintain their resilience and at times where it's deeply personal and at times where you can feel a bit isolated.
It's very true. Amanda?
Yeah, I mean, there's some really simple things that for me, and that was, finding, as we say, finding a reason to get up in the morning can be, the simplest thing, because when you can't is when people are in that dark place of shutting the curtains and hoping that nobody notices them. That's one of the biggest challenge, I think, of COVID, is that it's so easy to do that. in previous times, everybody would have been in the office and you'd be the person not. So it'd have been very obvious. Now it's not, because everybody's working from home. So that is a big challenge. I think, definitely, but finding ways to be gentle, be kind to yourself, have some of that compassion, because you've got to recognize that you're a human and not an automaton, and you can't just keep working as you were doing. And switching off as well. The amount of, I think, problems that come from the constantly, looking at what's the latest thing, what's been said, what's this mean, what does that mean, and I know I just end up non-stop watching the news and scrolling through social media, and that is not a good place for your mental health at all. So it's recognizing what are the stresses that are going to be obvious when I'm edging towards that dark place, and what can I do to deal with that? Finding a balance in your day, getting it sounds like really simple, but just getting some fresh air, getting some exercise, even though at the moment it may be that you can't meet other people and you can't do lots of things that you would normally do, but still just finding a way to not be within four walls, I think are really important. But it sounds really simple, but that for me has been what has helped me through. It's, what other things really matter to you? What are the things that can pull you through when you are heading towards a difficult place?
It's also those small things to be grateful for, and listing those, and slowly they get bigger, don't they? And you sort of start appreciating things a bit more. Sorry, my share just went.
I was going to say that was for me. That was for me. I know it sounds really simple, but if you can just say to yourself, even on the difficult days, I'm going to try and find 10 things today that I'm grateful for. There are always 10 things. Well, there are always 10 things you can be grateful for. The fact that you got up in the morning, the fact that you've got a roof over your head, the fact that there's food in the fridge, really simple things. But there's always something. It just changes your mindset from looking at all the things that, like Lizzie was saying, you can't control, that are outside of, and all those other potential problems with the way things are changing. But yeah, being able to just list 10 things is a real help.
It really is. I've got another audience question, and it's an interesting one. I'm going to ask you first, Lisi, what's the greatest challenge that you and your organizations have had to overcome in terms of this framed?
Yes, thank you. Yes. Well, I have the privilege to work with people with a lot of strength, not just physically, but mentally. And the problems that we have to adjust are very simple, because it's just stop traveling or time schedules, and sometimes having effective communication, because it's not the same to talk face to face to someone to fix a problem, or just dealing it via a phone call or Zoom meeting. And pretty much those have been the problems when it comes to COVID, and not to be able to process everything on time as we wanted, because we are in different time zones. But as I said, I am very proud and I am privileged to work with people who take ownership of their feelings, and they take control of what they are doing and what they are feeling, and they take care of themselves. And as Amanda was saying, it's so important to work out. And so they build this resilience, and they just have to adapt. So we just had to adapt. That's why we didn't have major issues with this. We just adapted. This is another step in life. Okay.
Yeah. Marcus.
So my organization team, we've been dealing a lot with loss at different scales, both personally and collectively as a team. And I'll say, I think as the pandemic is worn on, people are very much starting to share more, just dealing with the ambiguity and uncertainty of it all. I think, earlier on in the pandemic, there was still some belief that, you know, maybe things would be better by the summer. You talk, it's like the Stockdale's paradox, right? You have to get into that space mentally where you make the shift to confront the brutal facts that are in front of you and say, you know, we don't know what the end actually looks like. We're not sure what's going to come through with it, but we do have to find ways and find meaning through the moment. And so I think one of the things that we've been doing to kind of address kind of dealing with the sense of loss, dealing with the lack of control, and dealing with the ambiguity is really making sure that we continue to engage one another collectively, and providing some opportunity to make sure that ultimately, right, we keep some perspective about where we are and how we're going to engage.
And have faith that things will get better, however slowly.
Yeah, exactly. And being humble about that, the fact that it's not going to change automatically, and that the road to recovery is long, but it's definitely a road that you can take steps toward. So absolutely.
I find that's from a personal level, that's most difficult to communicate to younger people, because they don't have that learned experience of ups and downs over the years, where you can sort of take a more of a look backward and say, well, that was an awful time, but actually I know that I'll get through it, and so forth. Amanda, your thoughts?
Yeah, I mean, in terms of the biggest kind of challenge during COVID has been, I set up a business in COVID. So, you know, personally speaking, that's been a huge challenge, because everything that I thought was going to be the way everything was going to pan out has actually sort of changed a little bit. The flexibility and being able to just adapt has been critical. And I think that's, you know, I feel actually in quite a comfortable position, in that my world had totally changed anyway, and then the world changed. So it perhaps didn't feel as drastic to me as if everybody had carried on normally and my world had suddenly changed. But before that, obviously, was dealing with the Arena attack, which had such a huge impact on so many people. And I think, you know, it's been key in terms of some of the ways I've sort of looked at how I could manage things better, and obviously trying to then put that into how perhaps people can look at it as part of their crisis response. Who's in charge of the wellbeing? Who's actually looking at who needs help in the organisation? And that's a key one. So many times we're too busy with operationally, people are doing this and somebody's in charge of that. Actually, who's in charge of looking after the wellbeing and making sure that there's things in place, and you know, going out and doing that. And I think that's a critical element, really. But there's just, you know, there's a long road to go. I felt a bit like people thought I was a doom monger back in March, April, when I said this is going to be a year, 18 months at least. And they look at you and you think, well, you know, having been through things that we've been through, you can see the length of time this is going to take. And so back in May, June, when people were saying to me, could you help with that with our recovery communications? Well, I can, but actually I think you'll find this is going to be sometime in the future and not necessarily going to be that beneficial for you at the moment. But we always want to run through, you know, we've got to run as fast as we can to get through this crisis. And we can't, as Lizzie said before, this is out of our control. And you've got to accept what you can control, spheres of control, isn't it? I can control these things in my day, so I'll focus on those, because actually some of these things are just outside of my control. I can't impact on them.
That's absolutely true, and it's living with uncertainty, isn't it, which is really difficult. And I do take your point about being the doom monger. I think probably all of us here have been accused of that at one time or another, haven't we? I mean, we're close to finishing now. We've got about 2 minutes. Could I ask each of you, just for if you wanted the participants to take one thing away from this conversation, what would it be? And Marcus, I'll start with you.
I think one thing to take away is that there are places and spaces that are providing tools and resources to talk you through different elements of how to maintain hope and resilience during this time of crisis. There's a very helpful series of conversations led by Dr. Jamie Aiden, a disaster psychologist, that I think would be useful, but definitely continue to lean in to the resources that are available. And if you are responsible for that culture change, make sure that you're making investments in the systems of the organizations to help change that culture to be more embracing of hope and resilient practices.
That's a good point. Lisi.
Yes, thank you. Well, first of all, is talk about your concerns and take care of yourself. And with that, I mean, work out, hydrate, eat well, sleep well, and develop tolerance to uncertainty, because that is going to help you to become more resilient and also put things into perspective. Count your blessings.
That's a very good point. Amanda.
Can I just have that? I like the count your blessings, because that's. But I think for me, it's okay to not be okay is often what people say, but it's also okay to say that you need help, and talking about things. And if we could all open up a little bit about some of the mental health issues that we've all got, and if we're a bit more open about it, then it starts to become more accepted. Certainly in a lot of the emergency response field and world, I think the key for me is open up about it and make it part of your crisis response, both on an individual basis and on an organizational basis.
That's very true. And have tolerance. I mean, it's a shame that I always say this at the end of a webinar, but there's so much more to say and there's so much more we could discuss, but we are out of time now. I would say that these are issues that we will continue to cover and explore in the Crisis Response Journal. I'd thank you all for your participation, and thanks in particular to all three of our speakers for sharing their invaluable and frank insights. I really do appreciate that. Thanks also to IDME and ES for facilitating these discussions. And as this is the last of our webinars for this year, have a safe and peaceful and relaxing festive season. Here's to coping with 2021 in a resilient and positive way. And I really think we can do it if we look out for others and ourselves. 2 things to take from this: we are not invincible, and count your blessings. Thank you very much. Goodbye.